Mr. President, I call up my amendment per the order.
The clerk will report the amendment.
The senator from Vermont, Mr. Sanders, for himself and others, proposes an amendment number 2837 to amendment number 2786. Beginning on page 1, strike line 6 and all that follows to the end and insert the following.
I ask the amendment be considered as read.
President, I object.
Without objection.
I object.
Objection is heard.
B, table of contents. The table of contents of this act is as follows. Title I, American Health Security. Section 1000, short title. Subtitle A, payment for community-based primary health services.
I would ask that the amendment be considered as read so that I can offer the amendments.
Is there objection?
There is objection.
And may I ask
Objection is heard.
and may I ask my friend from may I ask my
Mr. President,
friend
regular
from
order.
Vermont.
May I ask my friend from Oklahoma why he is objecting?
Regular order, Mr. President.
Regular order is the reading of the amendment.
Section 1514, payments for prescription drugs. Section 1515, payments for approved devices and equipment. Section 1516, payments for other items and services. Section 1517,
of certain provisions in the Employee Retirement Income Security Act of 1974.
Mr. President,
A,
The senator from Vermont.
I withdraw my amendment. And Mr. President,
Regular order, Mr. President.
Mr. President,
The senator has that right. The amendment is withdrawn. Under the previous order, the senator from Vermont is recognized
thank you
for
very much.
30 minutes.
Mr. President, let me begin not by talking about my amendment, but by talking about Republican action right here on the floor of the Senate. Everybody in this country understands that our nation faces a significant number of major crises, whether it's the disintegration of our health care system, the fact that 17% of our people are unemployed or underemployed, 1 out of 4 of our children are living in food stamps. We've got 2 wars, we got global warming, we have a $12 trillion national debt, and the best the Republicans can do is try to bring the United States government to a halt by forcing a reading of a 700-page amendment. That is an outrage. People can have honest disagreements, but in this moment of crisis, it is wrong to bring the United States government to a halt. Now, Mr. President, I am very disturbed that I am unable to bring the amendment that I wanted to bring to the floor of the Senate dealing with a Medicare for All single-payer program. I want to thank Senator Reid for allowing me to try to bring this amendment to the floor before it was obstructed to and delayed and prevented by the Republican leadership. But I did want to mention that this legislation is co-sponsored by Senators Sherrod Brown and Roland Burris, and I was more than aware and very proud that this amendment would have been the first time in American history that a Medicare for All single-payer bill was brought before a floor of Congress. I was more than aware that that amendment would not win. I knew that. But I am absolutely convinced that this legislation or legislation like it will eventually become the law of the land.